All right, here we are, right back at you again. I'm Jamar Suber, and you are watching Legacy of Leaders. As you know, I talk to dynamic entrepreneurs, business owners from startup to seasoned, and we have in-depth conversations about their business and how their business is making a difference in the community. Today isn't any different. Today I'm with Johnny Helms of Tatonka Health, an amazing company. I had a few minutes to talk to him. Now it's your turn. Johnny, welcome to the show.
Thank you very much. Thank you for having me.
Tatonka Health, tell us about it.
Well, Tatonka Health is a Native American Indian company based here in Jacksonville, Florida. We provide healthcare IT for electronic medical records, so supporting a hospital for integration of EHR software. But we also provide medical staffing, doctors, nurses, physicians, and things like that. So as a hospital or dentist office or medical clinic need medical personnel, we're able to help fulfill that need. And then on the bottom side, we provide to manage IT services to any one of those customers for supporting their office or the EHR support or help desk in the healthcare field.
Wow, wow.
Yeah.
And as you know, this area that we're in here, just locally, it's huge. I mean, you have Mayo and Baptist and all these others. So do you work with smaller clinics or major hospitals?
Both. So Tatonka Health is the only Native American Indian healthcare IT company in the country.
Wow.
The only one. So we do a lot of work with the federal government for the VA, HHS, IHS, large hospitals like your Mayo clinics, but also your small mom and pop medical or dental office. So no matter how small, how large, we're able to work with them.
Wow, who's your target audience? Who's that sweet, where's the sweet spot for your company?
That sweet spot's a good question, because I think the sweet spots is going to be your medium hospitals, from your 250 bed hospitals all the way up to your large hospitals. But that 250 bed hospital is a area that we see that a lot of needs are, and a lot of the other companies kind of leave those size hospitals kind of floating to the side.
Okay.
So we see that's a small niche for us. Yeah.
So some years ago, we know there was a huge migration into digital documentation and things along those lines in hospitals, where technicians went out and they installed. So now, Tatonka, are you providing the support, or are you providing installations as well?
So we do both. So as the hospitals purchase their EHR software, we'll deploy our IT team to go and do the integration, but we also deploy our training team to train the doctors and the physicians and the nurses how to use that software. And then as we deploy that software, we'll have techs that'll stay on site to consistently manage that software. And then we'll have our help desk that 24/7, those doctors can call in and get support if they have any kind of issues on entering patients' data into that electronic medical record software. It's what we call Go Live. Go Live support.
Absolutely, absolutely. So when it comes to the programs that you support, the systems that you support, like your Epics and some of the others, what support do you provide? And let me rephrase the question. Which brands do you provide support to?
We do a lot of Epic, Cerner, All Scripts, and we have, there's probably about 20 different brands. But your major ones that we provide are your Epics, your Cerners, and your All Scripts. Those are mostly the ones that we see hospitals are using. And so when we provide that support, we bring in certified technical people that specialize in that brand. If it's Epic or Cerner, everything from the integration of that software to importing data over in that software from the old system to the new, to training of that software, because it's very important that the doctors understand how to use it. So when we bring in specialized technical people, we make sure they are specialized in that particular software.
So it's safe to say in some instances that Tatonka Health is a full service organization.
True, very true.
Implementation, training, support, and you recruit the staff to come in and service the hospital, the doctors, the nurses, the so on and so forth.
Yeah, and we decided to build the company in that way to provide a turnkey solution. We saw that hospitals constantly have to go out to multiple companies to pull those resources. And so Tatonka Health is just that one resource that a hospital or medical office can go to and get everything they need, on top of providing that cybersecurity support for HIPAA compliance as well. Because cybersecurity in the healthcare industry right now is very big, and that's another component that we provide with our managed services.
Yeah, absolutely. So there are several nurses and doctors in my family, and I know they're always being recruited and sent out, and If there are some doctors and nurses and hospitals looking to pull in some type of services and be sent out, how can they find your information?
They can go to tatonkahelp.com. That's T-O-N. I'm sorry, Tatonka health.com. And they can go there and pull information from the website. They can contact us through the website, and we can get in touch with them right away.
Okay. So if there's some upper management looking to make a migration to a different type of service other than Epic or Cerner or Allscripts, they can reach you the same way?
Yes, they can reach us the same way. They can go through the website. We have our number on there they can call, or they can easily call 706-248-1221 as well.
Okay. And if you could give that web address for us one more time.
That's Tatonka Health. That's Tatonka health.com.
Johnny, thank you for coming on the show.
Yes, thank you. I appreciate it.
Absolutely.
Yes.
You're watching Legacy of Leaders. I'm your host, Jamar Suber. Have a great day.